Coming of Age is coming up next. I'm your host, Emily Echeverria. Today we'll be joined by cardiologist Dr. Pelbreton Balfour to discuss strokes, the signs, treatments, and what recovery can look like. Next up, we're speaking with the director of A-Hope, an organization that supports pet owners and their furry friends in Santa Rosa County. Finally today, we're talking end-of-life care, what you need to know for this inevitable stage of life, and how planning early can help ease the burden on your loved ones. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. Stroke is the fifth leading cause of death in the United States. Today we will learn about the different types of strokes, signs that you or a loved one may be experiencing a stroke, what treatments are available, and how to prevent having a stroke. Here today to discuss this is Dr. Pelbreton Balfour, a cardiologist at the Baptist Heart and Vascular Institute. Dr. Balfour is also the non-invasive medical director for the Baptist Heart and Vascular Institute. Thank you for joining us today, Dr. Balfour.
Thank you for having me today.
So what exactly is a stroke?
So a stroke is an event that occurs when a blocked blood vessel decreases blood flow to supply to the brain. The two most common types of stroke, one is ischemic, which is usually due to a blocked artery, decreasing blood supply to the brain. Another kind is a hemorrhagic stroke or bleed stroke, where a blood vessel may rupture, leading to bleeding into the brain.
And why do people have strokes? Are there factors that are in our control?
Yes, great question. So we know that there are common what we call risk factors that make someone more likely to have a stroke. Common risk factors that we control include high blood pressure, smoking, diabetes, high cholesterol, some common risk factors that we can control.
Okay. So how does someone know that they're experiencing a stroke, and what signs should we look out for if someone else seems to be having a stroke?
Great question. In terms of what we should look out for, there's a short phrase we try to get people to remember. It's called be fast. B stands for balance. E starts for eyes. Are you noticing change in vision? F is face or facial. You can have what's called drooping of the face. A is arms. So if your arms or legs get weak. S is smile. So your smile can become, your speech. So if you had slurred speech or difficulty speaking. And then T is time. It's time to call 911 if you're experiencing any one of those symptoms.
Okay, so be fast. And if someone does have a stroke, what does the recovery for that look like?
Yes, so typical recovery could be anywhere from 3 to 5 days in the hospital in assessing why someone had a stroke, what their risk factors are individually, and then what type of rehabilitation that patient may need. They can require either inpatient rehabilitation or can be stable enough to go home and have outpatient services.
Okay. And if someone has already had a stroke, what are some of the best ways that they can prevent having another stroke or recurrence?
So I think one of the important things is maintaining close follow-up with your primary doctor or other specialists such as neurology or cardiology. Also knowing what your particular risk factors are. So what is your blood pressure? What are your cholesterol numbers? What are your blood glucose levels? And then what are your goals? Either you need to be on medications to help keep those things controlled, or in addition, lifestyle modifications such as healthy eating, increased physical activity, weight management, things of that nature.
And tell us a bit more about what it can maybe feel like if someone is experiencing a stroke themselves.
Well, they themselves may feel very fatigued. They themselves may notice a sudden change either in their vision, their speech, or not being able to say pick up a glass or something of that nature. And in that moment, they should call 911. Don't wait. Don't rest. Don't say I feel tired. We know that the sooner that you call 911 and get help, can be very good in terms of your outcomes down the road.
Gotcha. So what does it look like when someone is getting that treatment? They've just had a stroke, they've gone to the hospital. What happens then?
Right. So what happens is that you're evaluated by a team of specialists, one to identify the location of the stroke, the cause of the stroke, and then undergo additional tests to see if there are other things related to the stroke, such as your heart function. In addition, being evaluated to see what effects the stroke may have caused, such as any particular changes in your speech, your vision, your strength. So then developing a plan for your rehabilitation, which is a very important part of your recovery.
So there's the different kinds of therapies that you might be going to as part of that recovery, like a speech therapy or a physical therapy.
Yes, indeed. So speech therapy, physical therapy, occupational therapy, because there are different services set up even for simple things like relearning how to feed yourself, tie your shoes, things of that nature, depending on the effects from your stroke.
And that's kind of what occupational therapy is, those very specific tasks that you might need help relearning.
Indeed, things that we may not think about that may be affected, but very beneficial in terms of your overall recovery.
Absolutely. So what would you say are the big takeaways from this interview?
I would say the big takeaway is calling 911 fast. I think with the services that we're able to provide, it may be something as simple as administering aspirin to other therapies such as opening up a blocked blood vessel in the brain to restore blood flow. So calling 911 and being seen fast.
Gotcha. And so be fast and call 911 fast.
Yes.
Thank you for sharing this information with us today. Are you accepting new patients?
Yes, we are accepting new patients, and particularly don't wait until you have cardiovascular disease. We do preventative services as well, so that's very important to know what your risk factors are to prevent strokes.
And does someone need a referral to come see you?
No, you can self-refer or you can call our offices. You can also go online and make appointments. And if you have any questions, you can also talk with your primary care doctor to make a referral for you.
Perfect. So staying up to date on the kind of regular physical examinations and self-refer or get a referral from your physician?
Yes, very important to stay on top of your care.
Excellent. And thank you so much for joining us today, Dr. Balfour.
Thank you for having me.
Stay with us. We have an organization that helps the community care for our animal companions next.
If you're looking for a fun and exciting environment for your loved one, then L&L Executive Adult Daycare is a perfect fit. We offer social gatherings, physical activities, games, outings, and daily luncheons from Karen's Catering. We take a holistic approach to social stimulation and aim to enrich the lives of our guests. Let us help restore your loved one's mind, body, and soul. We'd love to speak to you. L&L Executive Adult Daycare. Big business love with small town feel.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference. The Beacon at Gulf Breeze offers the finest senior living community in the area. We are here for your loved ones who need assisted living and advanced memory care services. Seniors will feel right at home with studio, one-bedroom apartments, a large dining area, a beautiful landscape courtyard, and even a salon. With professional staff and one-on-one care, your loved ones are our top priority. Welcome to the Beacon at Gulf Breeze. Welcome home.
Our next guest is from the Santa Rosa County-based organization AHOPE, which stands for Animal Health Outreach Prevention Education. This nonprofit focuses on providing resources for pet owners in need, like low-cost spay and neuter options. They also have education initiatives to let the community know how they can foster a better environment for animals and pets in Santa Rosa County. And they provide the food for our Santa Rosa County Meals on Wheels for pets through their Bowl Fillers program. Today we have Vice President of AHOPE, Paige Cary. Thank you for joining us today.
Well, thank you, Emily. It's a pleasure to be here.
First, tell us a bit about AHOPE and the services and programs that you offer.
Okay, well, and you did a great job with that in the opening. Yes, we are known for our affordable spay, neuter, vaccine, microchip services that we provide, really not just to Santa Rosa County, but to the whole panhandle per se. And as you mentioned, our Bowl Fillers program with the Council on Aging, we provide information and assistance in regards to trap, neuter release of community cats. We can help with different types of services people need to find vet services, or need information on types of food, or just things like that. We're here to provide any help and resource to people so that they can keep their pets in their homes and they do not have to feel like they can relinquish them to the shelter as an option.
So kind of any questions people have, they can call you up and get
Yes.
information, referrals, resources, that kind of thing.
Yes, we have a lot of resources, absolutely.
Excellent. And like we were saying, you provide the pet food for the Bowl Fillers program for our Meals on Wheels on Pets in Santa Rosa County. How did you get involved in that, and how did you connect with our agency?
Well, I like to consider it really divine intervention, so to speak, because we actually had received a huge influx of dog food, dry dog food, with nowhere to store it, and we were worried that it was going to, get moldy or need to be thrown away. Our president, Brandy Winkleman, had happened to meet, it was Lauren Clark at the time, your development director, and Lauren proceeded to tell us about the story that was going around the country, here locally as well as regionally, nationally, of Meals on Wheels drivers realizing that their clients were becoming malnourished. And when they started looking into that, the clients were actually feeding their meals to their pets because that's their family, and they couldn't afford the food. So they were going without in order to feed their pets. So that's when the idea of the Bowl Fillers came up, to help seniors in need provide pet food, a toy, and a treat each month to their dogs and cats.
We love this program. So how would someone get involved in this program?
Well, and that's one of the main reasons why I'm so happy to be here today, is because we've had up to 14, 15 clients, families in the program before, but our numbers have dwindled. So the main thing is, if there is a senior in Santa Rosa County that has pets and needs assistance, please speak to your Meals on Wheels driver. They have forms that you can fill out that will then circle back to us. We will add you to the list, be in contact with you, and get you the things that you need each month.
Great. And what was the response like to this program? And like you said, when it kicked off, it had 14, 15 people on it.
The community response has been amazing. I mean, who doesn't love Council on Aging? Like I said, near and dear to my heart. And the response was so overwhelming. We have so many. We choose to go a different route. We have sponsors each month that provide the food and the treats and the toys for the animals. And literally for this year, we were filled up probably by February 1st of March for the whole rest of the year.
Wow. We
have sponsors like the Pullum YMCA in Navarre, Phil Hall Attorney in Pensacola, Carrie Ann Schultz, Lynn Peters, First United Methodist Church in Pace. So any group that would like to participate, whether an organization, a church, an office, please reach out to us and we'll be glad to get you signed up for next year. So
Excellent.
The response has just been overwhelming.
Yeah, I love that. And what are some other ways that people can get involved with AHOPE, whether they want to volunteer or foster animals? What are some of the ways they can get involved with that?
Well, absolutely. They can go to our website, AHOPE, the number 4, src.com, and we have everything that we encompass on there. And certainly we always need volunteers, and there's many, many things that can be done from home. You know, if a person doesn't have transportation or things like that, they can help us answer emails, return phone calls, but there's also a lot of things they can do in person. We always need fosters. It's kitten season, and there's just not enough. There's way more kittens than there are fosters. So if anybody has time and would like to help with that, just reach out on our website, give us a call, and we'll get you signed up and get you started.
Awesome. So what is your organization's greatest need at the moment?
Well, right now, we are in the process of building an affordable spay-neuter vaccine microchip clinic right in Milton on Pine Blossom Road. And it will serve, while we're located in Santa Rosa County in Milton, like I said, we serve the whole panhandle. So this clinic will be for everyone. And it's particularly important for seniors and the community because it will allow them to take care of their pets, provide basic services like getting them spayed and neutered and vaccinated without having to worry about, well, do I still have money for rent? You know? So right now, our needs are, you know, donations for that, or if you have services that you can provide, like we'll need people to paint the inside of the building, electrical, plumbing, all of that type thing. If you have access to, you know, companies like that would like to do in-kind donations and help us out, that would be amazing. It'd help us get started that much quicker.
So what all kinds of animals do you work with? Because I saw about the kittens that have been helped and the fancy rats as well.
Right. And we don't discriminate against dogs, so please don't get upset when you look at our website and see only kittens. There are many dog rescues, and cats are an overwhelming issue because people think they're just disposable and they don't get them fixed, and so goes on and on. So we help the shelter, the Santa Rosa County shelter, by taking in needy kittens, sick ones, bottle babies that maybe their foster program, they don't have enough fosters, and then we help get them, take care of their medical needs, get them well, get them adopted. So we do that, as well as the fancy rats like you mentioned. And once the clinic is opened, obviously we'll be able to spay neuter more dogs, cats, that type thing. So people think, well gosh, you're just cats. No, we're not.
Gotcha. And is there anything else you'd like people to know about A-Hope that we haven't covered?
Well, I mean, we covered a lot in a short amount of time, but like I said, please visit our website. And the main thing, you know, if you can't do anything else, just like our Facebook page. Go to Facebook, A-Hope, like our page, and then just share our post. Because I always like to say, you never know who knows who. And so that may help someone in need. It may help someone that wants to contribute to the clinic. So that's an easy thing to do. Like I said, right from home, just share our Facebook page, and that would be amazing.
Perfect. Thank you so much for joining us today.
Well, thank you. It was a pleasure.
Next up, we're discussing end-of-life care, how to prepare, and the time to start. Stay tuned.
Over 2 decades ago, TLC Caregivers partnered with the Council on Aging of West Florida to assist seniors with non-medical help to stay independent in their own homes. Our commitment to providing these services started in 1989 and has grown to aid people from birth through geriatrics, from a short visit of 2 hours to 24 hours a day. We're a proud sponsor of the Council on Aging of West Florida. We're TLC Caregivers.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
They call me Prince like I'm royalty or something. But the places I've lived ain't no palaces. So I don't need grilled salmon or a new scratching post. Just give me a cardboard box and a can of tuna and we're good. You can even change my name. I'm cool being the kitty formerly known as Prince.
End-of-life care can be a difficult topic to discuss. However, it is essential to get informed of your options to ensure you and your loved ones can be prepared. Hospice is a patient-centered approach to quality of life in our sunset years, and it has proven to take some of the strains off of patients and their family during this challenging time. Here to tell us more about these issues are Melissa Carroll and Liz Kilcawley with Emerald Coast Hospice. Thank you both for joining me today.
Absolutely.
So first of all, can you tell us a little bit about Emerald Coast Hospice and each of your roles there?
Sure. So Emerald Coast Hospice services all of the Emerald Coast. We have 8 branches that span from Pensacola out past Mariana and then into the Panama City area. And I am the director of the Pensacola branch here that services the majority of Santa Rosa down by the beach, as well as Escambia County.
I'm Liz Kilcawley. I am the hospice care consultant for a certain region of our area. And I love being part of our team. It's a great team to be part of.
Wonderful. So what qualifications must a person meet for going into hospice care?
So in order to be considered hospice appropriate, it requires 2 physicians to have solid conversations around the prognosis of a specific disease process. And when they do that, they make the decision that a patient has less than 6 months to live if a disease finishes out the course that it typically does. We try to capture those families as early as possible in that 6 months, but we will take care of anyone regardless of how much time that they may have with us in that disease projection.
Gotcha. And what is the end-of-life care experience like for a patient and for their family?
So we operate on a very individualized care plan. Whatever the family needs, that's what we tailor to. Some patients have hospice aides that come up to 5-6 times a week. Others opt to only have their nurse come, but they do have a myriad of resources that are available to them. And we cover not just the symptom management, the clinical piece of what's going on with the family. We also focus on the psychosocial support that they're going to need, the emotional and spiritual support. So we double up with chaplains, social workers, all kinds of stuff to help families get through those rough times.
And where does this care take place?
Wherever a patient calls home. So we don't have necessarily a limitation. We have taken care of patients in long-term care facilities. We do general inpatient care in facilities that we have contracts with, like Baptist Hospital. We take care of them in traditional homes, assisted living, and independent living. So wherever home is, we're happy to come in and help.
And what do services look like for those individuals with dementia, for patients that have some level of cognitive impairment?
So what we find is that patients with dementia, it's very taxing to get their activities of daily living taken care of. So we really try to focus on relieving that burden of care on the caregiver's part. So daughters can be returned to being daughters, not necessarily 24-hour caregivers. Our hospice aides can go in and assist with bathing. We do tons and tons of training on how to help with symptom management, when it is and is not appropriate to redirect their loved one, if it's something that's not burdening them, to let it play itself out. But as far as a cookie cutter plan of care, there's no such thing in hospice. We specialize in meeting families exactly where they are and taking care of that family with whatever their needs are.
Mm-hmm. So making a very unique plan for
absolutely
each individual situation.
No two plans of care are alike.
Gotcha. I understand you have a We Honor Veterans program. Can you tell me a little bit about that?
We do. Our volunteer coordinator, Bridget Johnson, heads that up. We are very thankful for the veterans that live in our community. This is a very veteran-strong community. We try to match veteran to veteran with a volunteer. Veterans that can go in and have camaraderie and companionship. We also do very special things, obviously around Veterans Day, recognizing their services, but we also do a final salute in the event that a veteran passes away. We try to make sure that we have a flag in the home. We try to make that very meaningful for the family so that in the event that they do pass away in the home, that they're draped in a flag as they leave, and we honor their service.
Great. Does insurance cover these types of services that you offer?
Absolutely. So We actually, as a not-for-profit, we take care of everyone regardless of their ability to pay, but by definition, it is the Medicare benefit of hospice. And so Medicare pays 100% for the hospice benefit. We also take payer sources like Medicaid and commercial insurances. Sometimes there might be a copay if it's a commercial insurance, but Medicaid as well also typically will pay 100%.
Okay. So how do you keep the families involved in the whole process?
So that individualized plan of care is what is super important. Our social workers, nurses, and chaplains are all working together to make sure that our unit of care, which is actually the family and not the patient, is what we are servicing the best. We try to review that plan of care every 2 weeks with the family, make sure that they're updated with what the prognosis is, the progression of the disease process, because we're working on more than just physical symptoms. We're working on their pre-bereavement, their grief process that they're experiencing, because grief does not suddenly hit when a patient passes. You start doing that grief work much earlier.
And tell me a little bit more about those emotional and psychosocial resources that you have for the caregivers who are going through this process.
So our social workers specialize in the psychosocial needs of these families. They can do pre-bereavement work where they start working on the grief process with them. It's not a linear process. You don't check one box and move to the next. And so sometimes those things can pop back up. Chaplains as well are very well versed in that. And we also have a bereavement coordinator that can come in if it is a more complicated issue, if there are more family dynamics that need to be addressed. And that bereavement counselor actually follows the family for 13 months after a patient passes away. They want to make sure that they get you through all the firsts. So the first Christmas, the first anniversary, the first birthday. There is a lot of time that's spent with a family after a patient passes away. It is not that they pass and they're no longer part of our Emerald Coast family.
Sure.
They stay with us.
Oh, that's excellent. Thank you both for joining us today. We're so glad to have you telling us about these important services.
Absolutely. Thanks
Thank you for having us.
Yeah. And thank you for watching. Until next time, enjoy life. You've earned it.